Dr. Denise Ejo, the CEO of Cornwood Cancer Foundation. I would like to welcome you to our Cornwood Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Put all the machines on and get ready for us to start. Not very good at machines, so good morning, everyone. All right. Hello, Dr. Charles. How are you? Our guest is in the house.
Hi, Dennis. I'm all right. Thank you.
Fantastic. Dr. Charles. Just bear with me, people. I just want one more item on this thing, and then I think I should be. No, that's not it. Dr. Charles knows how to give me homework, but no wahala. Dr. Charles, you know that you didn't send me something I asked you for on your WhatsApp.
Okay, the intro.
Can I have it, please? In writing, send it now.
Okay.
I'm going to read it. Good morning, everyone, and welcome to Cornwood Cancer Foundation. We're about to start in a few minutes. I'm just trying to make sure everything is in. And what's the time now? So it's 6 minutes. Let's see if we can start at 10 past so that we can finish on time. Today in the house, we've got Dr. Charles Okufo, who is a specialist in head and neck cancers. So let's see what we're going to be learning about it today. In a few minutes, we should be going. So let's give ourselves 4 minutes to allow others join, because it's now, the joinings are coming in. So let me just get that done. I think the Facebook Live is now on. Whew. Let me see. Okay, so I think we're almost there. We're making slow but steady progress. It's very interesting when you have to man what do you call it? The screen, as well as looking at this. So I am good. Hope everyone's good. Dr. Charles, can you come on now? Come on. Just put your face back. I put Dr. Charles on that US just now. All right, sorry. Okay. Where am I? All right. We're going. I'm ready. Dr. Charles, are you good?
Yeah, I'm good. Yeah. Are we still waiting for any more people to join? Is 4 minutes over?
No. We're going to start. Yes.
Okay.
All the other platforms are on, so it's fine. Good morning, everyone. Good morning, good afternoon. Okay, now my time zones have changed, so we're back to good afternoon. We're back to Nigerian time. Good morning and good afternoon, everyone. My name is Dr. Denise Edjo, the CEO of Cornwood Cancer Foundation. Today we have in the house Dr. Charles Ekufo, who is a specialist in head and neck cancers. We will be talking about the different. He's going to tell us whatever we need to know as a layman on what we need to know about head and neck cancer. Today, we will also be looking at any questions, questions people have. Can you please either put it in the chat box? I think the chat box is open. And if it's not, can you, it should be open. No, chat box is open. Don't say that, Denise. The chat box is open and we'll take questions from there. For those of you joining on the Facebook page, you're welcome to this forum. And we have taken a new dimension. We're now going to get everybody to start registering so that we can start manning the numbers of people registered against those who are on. So today, Dr. Charles, you are welcome to this platform where it is titled, Let's Talk About It. It in the sense that everybody doesn't want to use the word cancer. We say it, or we call it everything but what it is. As a survivor of cancer, or that's what I'm told, I also say to people, let's be realistic. It's called living with cancer, which means you have cancer in your body and you just have to deal with it. That's where we are. So today, we're having you to talk about head and neck. I'm only familiar with brain and breast. So trust me, I got a lot of questions for you. Everybody who has questions, please start putting them in the chats as he starts to talk, and let's see what we can get through in the next few minutes. Dr. Charles is an oncologist, a clinical oncologist. Please bear in mind, I am not a science person. I am a maths teacher. I like to say that. I love being called a maths teacher. It's very nice. Okay, and he specializes actually in head and neck cancer. And he is, we call him Dr. Charles. If I try anything else, I must probably get it wrong. Dr. Charles, welcome on board. Welcome onto this platform. We look forward to an interesting conversation with you, and I will be muting my mic. So if you want anything, just tell me, and I will put your slides up. As soon as you put your hands up, I'll just do it.
Okay.
Over to you.
All right. Welcome, everyone. So today we'll be talking about head and neck cancers, more like a simplistic journey through the diagnosis, management, and thereafter. Okay, so I'll probably just share the screen now, then so we can start. Don't know if you're able to share with my screen, Dennis.
You can share.
Okay.
I haven't touched it.
Okay. So are we able to see the PowerPoint presentation? Are we able to see the screen there? No?
No. Sorry, no. Sorry, my thing was off. No.
No. Okay. I'll try one more time.
Dr. Charles, you have already tested this.
I know, but
oh gosh. No, voila.
I don't know if probably you need to send a request. Hold on, let me just try again. Hold on. Yeah. My fault.
So it's yours, right? All right.
Yes, yeah.
I'm off. Okay.
I don't know. Are you able to see the screen at the moment?
Yes, we're good now. We're good now.
Yes, we are good.
All right, thank you. Just give me 1 minute, just putting it in there. All right, thank you. So welcome everyone again. So my name is Charles. I'm a clinical oncologist. So one of the cancers I do is head and neck cancers. So I would be talking about that today, head and neck cancers, and we're going to talk about more like the journey through head and neck cancers from diagnosis and to the management and what to expect, so that if someone needs like a reference or like a simplistic overview of head and neck cancers, you can use this as So when we talk about head and neck cancers, we talk about cancers around the head region and including the neck, and there's quite a number of them. It could be so head and neck cancer involves that just from the head region, but usually excluding the brain. So we usually don't, for the sake of this presentation, we won't be talking about brain tumors, but mostly anything else around the head and neck mostly. So the eyes, the nose, the mouth are all part of the head and neck. Behind the nose, you will have what they call the nasopharynx, and they are all part of what we call the aerodigestive tract. We also have the neck region, which has muscle, some glands, some bones, and some cartilage. These are all tissues that can be found around the head and neck region. And of course, don't forget the tongue and the soft palate and hard palate. That's the hard part on at the roof of the mouth. So how common are these cancers? So they're not very common cancers generally, but they actually are a major cause of concern when they happen, because head and neck cancers account for like about the 6th commonest cause of cancer mortality. So it's they're very important, and their treatments, are quite unique. So there are some risk factors for developing head and neck cancers. Risk factors means that, things that can make you a bit prone to having something. So in this case, tobacco abuse in the form of smoking or every other use. Some people chew tobacco. These could increase the risk of head and neck cancers. Alcohol consumption also can also increase the risk. And also some of the head and neck cancers, especially those around the back of the throat, have been linked to HPV, which is a virus. HPV is human papilloma virus. It's indicated with a lot of other cancers, especially cancer of around what they call the cervix in women, but HPV also linked to this cancer around the back of the throat. So we'll start. So how does it start? So, cancer symptoms sometimes could be vague and sometimes could present as a lot of things, but some of the commonest symptoms you would get, could get from if there is cancer, it could be sore throat. So a pain in the throat, despite different therapies and all that, does not go away and probably becomes worse, should be consigning for probably might be cancer. Of definitely most sore throats are not cancer, almost a lot of them are not. But when someone has a sore throat, non-healing, persist for months and a long time, one should be suspicious. Then some people could also find it difficult to swallow. So difficult with swallowing, it's a symptom also. And some people also feel like a lump in the throat or lump while swallowing, okay? A change in the voice. So one of the common sites of cancers around the head and neck region is called the voice box, also known as the larynx. And one of the symptoms is a change in the voice. So once your voice becomes a bit hoarse, bit squeaky and all that, you should be consigned. There's a lot of things that can cause a change in your voice, which include even the respiratory tract infection or straining and all that. But once you notice a change in your voice and becomes worse over the next weeks and all that, you should definitely be consigned and probably see a physician or a doctor. Okay. Some people get neck swelling, as symptoms. The neck has some lymph glands which could become involved. So some of the cancers can spread to some of these lymph nodes, and those glands can swell and they can be visible. So those should be concerning. And it could also be a cancer right in the neck region, probably arising from some of the structures around the neck. Then bleeding also from the nose or the mouth, when it's persistent, recurrent, despite everything else, should be concerning. Some people could get hearing difficulties. It could be a cancer arising from the head and neck region or even from the ear itself. And some people can have what they call the local symptoms of this tumor, could be quiet, and they just present in more advanced symptoms. Probably, fortunately, it might have spread to other parts of the body, including the lungs. So they could come with difficulty with breathing or feeling very tired, not able to eat, losing energy. So, this could be some of the symptoms. There's also other symptoms that can also occur, and some of the signs, when we examine, when a medical doctor or a physician examines you, might be able to elicit some of these things. So, peradventure, someone has some of these symptoms and it persists, and you realize it's not, going away anytime soon. You might want to see the physician, and they might need to do probably ask you some questions just to get to the bottom of it to make sure it's something something that you can treat, or something more concerning like cancer around the head and neck region. So you might also be examined. The physician might examine your neck, look into your throat, and we could also do what they call an endoscopy. Endoscopy is like a camera test where like a tube goes into through the mouth or through the nose, as the case may be, and we'll just look at those regions around the head and neck region, and to see if there's any consign or ulcer or tumor mass in the neck region. Then also other things to help to make this diagnosis, to be able to say, okay, someone might have this, would be imaging. So, and there's several imaging, including what we call a CT scan, which is like image modality. You go into like a wide bore tube, and it gives us a very good image. We're able to see the different structures. There's also the MRI scan, and there's other things like the PET scan, including a simple investigation, even like X-rays, can help sometimes to get a diagnosis. So in addition, you might need some blood tests done you might request some blood tests to see how you are, just to get a picture of, any other concerning comorbidities, and, you might be going for treatment, depending on what we find, to see how fit you are, and to test, they might also do a blood test, probably to test for some things that, might help us with making a diagnosis. So to be able to make a diagnosis categorically, the one way is do use of a biopsy. Okay, so the biopsy involves taking a sample, a tissue, that's different means to get that, but so just make it simple so it involves taking a sample, sending it to the lab, looking at it under the microscope, and we see that some of those cells, from those tissue we get are probably abnormal and they look cancerous. And, the histopathologists or the pathologists are able to tell us if this is cancerous or not. If you have been diagnosed with head and neck cancers, you'll proceed to the next thing where you would need some assessment done. Assessment because some of these cancers can affect your nutrition, and you can remember I said some of the symptoms are difficulty with swallowing, painful swallowing also is some symptoms. So we need to assess your nutrition, see how if you're losing weight, and dietitian might recommend some, supplements to help. Some people might also have problem with their speech. So like people with cancer around the voice box can have problem with the speech, and also problem with swallowing. Also people with cancers around the back of the throat or around the neck region. Then also a dental assessment is quite important for quite a number of them, because some of these treatments, if someone has like a dental caries, it can become worse. So sometimes, fortunately for some people, they might need some of the bad tooth out, before they start some treatment. Okay. So after we're done assessing and getting a diagnosis and getting the image, the oncologist or the physician might discuss about staging and grade. So some of you already know, staging is more like how to tell how advanced your cancer is. Generally, people say stage 1, stage 2, stage 3, stage 4. So it all depends on what we find on your imaging and the different modalities, clinical assessments, to determine what stage you are. And the stage you are will also determine what kind of treatments you would need and how much of the treatments you will need. Also the grade, so some people say, okay, it's high grade, low grade, but not all the cancers have things like that. So many things anyways behind the scene, or I'll just say that's also been looked at, by the pathologist and even to see how this cancer look like, how, the behavior of the cancer, and to be able to target these cancers and treat them properly. Okay. So the treatments of the head and neck cancers, is best treated in a specialist center where we have the oncologists, the radiologists, the surgeons, as the case may be, nutritionists, speech and language therapists, radiograph, just everyone needed to treat you. Cancers are best discussed in a multidisciplinary team where all the specialists talk about, what's the best way of treatment, and they have a meeting and go through the imaging, your biopsy results and different results to discuss the best way to treat you or the treatment options. But the decision, the treatment or management is a two-way street. So it's always a discussion with yourself to see what you want, what you think, including, some people once they have family or friends or loved one or partner involved in their management. So those people can be asked to join in a clinical meeting also to discuss the treatment decision. Treatment decision involves an informed consent. So you need to know what the treatment options are, what you stand to benefit, what the risks are. So the risk be like the side effects, that might occur, how would they go away? Would they be permanent? Then you can decide, with the help of the oncologist or the physician or the surgeons, if you want to proceed with treatment. So several treatment modalities. Surgery is one of the main treatments in head and neck cancers. Surgery involves removal of all the tumor, sometimes most of it, and sometimes some of it. It all depends. Sometimes you go to surgery and during the surgery, you find something a bit different, or you're not able to do move as much. But quite a number of times, some surgeons are able to remove all the tumors, and that might even be it for early cancers. And not all the cancers will require surgery. As I said, the modalities of treatment, depending on the cancer type, your stage, a lot of things, are actually looked at to decide what might be the best route, in addition with a discussion with the patient involved or the person involved. Other procedures for some of the head and neck cancers, one might notice some other procedures being done. As I said, some people might need some tooth extractions. Some people might need what they call a trachea, called a tracheostomy, where they need an extra tube with their neck to breathe, because sometimes the surgery or some of the other procedures might cause difficulty with breathing. Some people might even need what they call a bypass of the mouth region, so be able to treat that, getting what they call a feeding tube. Another form of treatment is called radiotherapy, and it's quite useful for quite a number of head and neck cancers. Okay, some cancers, like probably cancers of the voice box, the early stage of it, some people can benefit from just surgery, just radiotherapy alone. Sometimes even some other forms of therapy like laser therapy, but radiotherapy is an important modality in treatment of head and neck cancers. Radiotherapy means using of high energy radiation to treat the cancer cells, or tumor cells in this case. The treatment usually of radiation, usually on a Monday to Friday, except the weekends. And it uses what they call a linear accelerator. In some countries use some radiotherapy machines called cobalt or proton. There's several radiotherapy machines that can be used, but commonly it's the linear accelerator. The radiotherapy would involve you us having an assessment for you to see how you are. You might need an imaging to be able to, for us to be able to target the treatment. So they are much improved radiotherapy technique than we had in the past, where radiation is able to target the tumor to treat this cancer. The aim of the radiotherapy also can be with the curative intent, means that your radiation therapy would be able to get rid of the cancer in the head and neck region. And sometimes the cancer, we might not be able to get rid of this cancer because of how advanced it is. And we might be able to just treat the cancer and give it tumor control or to help with some symptoms. So radiotherapy would involve that. And involves usually people lie on this. So just to explain how the radiotherapy looks like. So you come in, get your scans, then thereafter you're asked to come back to start treatment at a later date. When you come back, usually you lie comfortably on the couch. They set you up, we set you up with different techniques. Quite a number of times we use what they call a thermoplastic mask, where It's quite, it's not as uncomfortable as it looks on this picture, but the idea is to reduce the movement. This lady is able to breathe properly. It's quite tolerable for a lot of people. Okay. And during the radiotherapy, we also assess you for side effects of treatment. So other treatment modalities include chemotherapy. So chemotherapy includes use of some medications. Sometimes you could swallow it, sometimes you put into the veins in this, like demonstrated in this picture, to treat the cancer. You could get it every week, every 3 weeks, or as the case may be, depending on what you're getting. And it's also used to treat the cancer. It also depends on the cancer. Not all the cancer require chemotherapy, and not all the stages require chemotherapy. Same with the different modalities. So I'm just giving like a general overview of the treatment, because treatment modalities now are quite unique to each cancer type and each stage and specificity of the tumor. So sometimes we combine chemotherapy and radiotherapy. So don't be surprised if you hear someone who has diagnosis of head and neck cancer is able to, the oncologists discuss combination of both. The combination of both helps in some cancers to improve the sensitivity of the cancer and to make the treatment a bit more effective. Not all the cancers will require a combination of both, and not all the cancers, why some cancers are sensitive to combination, but some are not, and some depend on the stage also, we might be able to combine both. Some people might also need chemotherapy upfront before they get surgery or before they get radiotherapy. The aim of that usually is to shrink the tumor and make it easier for to treat. So there are other modalities now involving in head and neck cancers, compared to the past, and they involve what we call targeted therapy and immunotherapy. And these are usually used for a bit more advanced tumor to treat head and neck cancers. Not for all the case. Sometimes we combine some targeted therapy with radiotherapy for some tumor types. So as I said, these treatments do have their side effects, like the chemotherapy. Some of you already know some of the side effects might include nausea, feeling a bit more tired, slight increased risk of an infection. Some people are not able to tolerate the chemotherapy, so probably we have to probably stop the chemotherapy and use other treatments for them. Also, radiotherapy, in addition, has some of the side effects depending on what is being used. And same with surgery. Quite a number of people, some people would recover, quite a number of people would recover from some of their side effects at the completion of treatment after some weeks from completion. Some side effects may linger on, but it all depends on what is being used to treat you and what and your stage and the individual person. Before you start most of this treatment, you'll be told what to expect. It's quite important, and it's quite important most people have good support to be able to inform their clinician when they have any of the side effects. So I'll discuss the after treatment of the head and neck cancer. So after treatment of head and neck cancers involves, so what happens next after you've had any of this treatment? So it will involve you might need an assessment again, a clinical assessment, including imaging periodically. It all depends on what kind of cancer you have also, and we might see you from time to time. Also, we want to know about some of the side effects. Have they resolved, and help you with some of them, probably with some therapies, medications, depending on them. as I said, support is extremely important, to the anyone who is who's been diagnosed with head and neck cancer, including that support for the family, loved ones, and to go through the process. Some of the treatment could be tough, but with some of the support, a lot of people could go through it. And I said the treatments all depends on, the stage, the type of the tumor, what we see in the biopsy, histology, all that. All right, so I think that will be an overview. Thank you very much.
Thank you, Dr. Charles, for that. Are you ready for this? Before we go very far, I want to ask one very simple question. What is the prognosis? What's the data telling us about people that have head and neck cancer and survivors?
Survivors, okay. So the prognosis, it's quite variable. So you could have prognosis, survivor as high as 90% for some of the cancers, like cancer of the larynx. And it also depends on what your stage is. Some survivor could be as low as, probably 10%. It all depends on and it all depends on how, survivor, I talk about survivor, but cure rate, survivor spend number of years after the people, someone who is diagnosed with this cancer live and all that. And the prognosis also depend on the age of the person, the biology and the type of the tumor. So it's quite quite variable. It's not straightforward. So many things we use to prognosticate, but individuals would have their, discuss a prognosis based on that individual,
I'm actually asking because head and neck is not very well discussed. And it doesn't fall in like the first 5 or maybe even 10 that is a serious cause for concern. Yeah. In the sense that when you talk about number of people that die from breast cancer, ovarian cancer, prostate cancer, we are fully aware that those figures are interesting. And now we've even got endometriosis, which is now coming up from somewhere else to come and give us headache. However, when you look at head and neck, it seems that, I don't know which one it is, but it seems that the head and neck, there are some cancers in the head and neck that actually the prognosis is quite good. And if people know that at least when you have it, there is a good chance, it helps us, because as an organization that focuses mainly on awareness, we want to make people navigate towards the fact that there is hope and there is a good chance. And once you know what to do, you know how to get past it. So that's why I have come to it from that perspective. And that's why I'm asking this particular question before we start. So anybody who has questions now, you can start with your questions in the box while Dr. Charles starts to get ready for your questions and answers. But that was one of the first things that has come up for me, because you seem to have quite a lot of cancers that happen in the head and neck. Am I right to assume that?
Yeah, so there's a lot of cancers that can happen in the head and neck, because you can see the head and neck is a complex region. You have a lot of structures there in the, the tongue, the nose, the eyes, the ears, where you swallow, the throat, even the teeth and all that. So the prognosis will also depend on your stage, the age, what kind of treatment you're able to tolerate. Some of the laryngeal cancers, for example, the early laryngeal cancers, they have a very good prognosis, and it also depends on the histology type. There's quite a number of things to use, but some of the cancers of the back of the throat can easily be, have good prognosis. So there's a chance that we would get rid of this cancer if found early. There are also there's some viral driven cancers around the back of the throat, which have a better prognosis than like non-viral driven cancers. And the non-viral driven cancers, for example, in the throat, which of the back of the throat, which is called the oropharynx, like those caused by smoking, do not have good prognosis as compared to those caused by the virus HPV. So it all depends, and it all depends on with surgery. If you're able to get, some people get surgery and that's it there. Some people get surgery, unfortunately, you're not able to get rid of all the cancers. The margin of the surgery seem involved. They need further treatment sometimes.
There's another question I need to know, which comes back again to talking about this cancer. HPV seems to be a very common. I'm not a medic, so I always try to come from the part that I'm not a medic, although there's a doctor involved. I'm an educationist, and that is why this works for me, because education is awareness. That particular part is a big issue when you look at HPV. I hear HPV. HPV is like it's the disease. You see, I don't even know. I just HPV is HPV.
So HPV is quite important in mostly around cancers of the back of the throat, called oropharyngeal cancers. They have been implicated, and they're really important even to prognosticate some of those cancers. I said those ones are HPV viral driven. It's involved. HPV infection, quite a number of them, the commonest route is through sexual contact. That's how quite a number of people get HPV. But I won't dwell much on that today. But once someone has HPV infection, can be persistent and increases the risk of having oropharyngeal cancer, some other cancers. There are other viral infections like what we call Epstein-Barr virus. But that's to talk about that one that can cause some of the other cancers around what we call the nasopharynx, just behind the nose, and all that. But
now that's very interesting, because I always say this: my people perish due to lack of knowledge. I never ever did the 1 + 1 = 2, and for a maths person, it's very important when we play with data. So for the first time, you just hit something for me. Okay, I've got a question for you anyway. So let's check what is the question. Sorry. Where's my question now? Okay, let's start to go. The first one, in fact, I didn't even realize that was the first one. It says, you mentioned HPV as a cause of throat cancer. Yes. I don't know if you can read it. Can the vaccines taken to prevent HPV cause cervical cancer in women be taken by the general population to prevent throat cancer?
So, yes.
Can you see your screen? Because you can see the question.
Okay, let me just go to the chat box. I suppose these questions are in the chat box.
Yes, that's what I'm asking you.
So yeah, so the vaccines, some in a way could be extended to say, since it prevents cervical cancer, there's no real data, I'm not aware of any data to say, okay, the vaccination has helped to prevent the cancer of the throat, head and neck, or rather the throat, back of the throat. But given that it's kind of almost the same HPV, probably if you extend the vaccine to involve especially those serotypes that causes the one in the throat, could help prevent it, especially vaccine has it given, at early stage, so that the body can fight against this infection. So in a way, but there's no strict data on that. And bear in mind, HPV is more of the back of the throat. There's a lot and lots of other cancers that HPV has nothing to do with, so many other cancers, like some data from Nigeria, I was looking at, some of the commonest ones from that data, like from a cancer registry, they listed like the ones behind the nose, the cancer called nasopharynx as common. Some other places have the oral cavity as commonest. So most of those cancers have nothing to do with HPV, so.
Okay, now there's one that I really like, which is to do with the mouth ulcers. Which of these ulcers should we be concerned with from a cancer perspective? To do with mouth ulcers, because mouth ulcers, we get it. It's like yeah, it's all the time. And are there things that people need to be aware of? Is there anything genetically people need to be aware of? Are there behaviors or, okay, I'll give you one. When I was way younger, I used to, that was when I was in Nigeria, in rural Nigeria. Yeah, I used to get a lot of ulcers. As I've grown older, I don't have it, but then, are there relationships? Are there any, yeah? I don't know if you get what I'm trying to say, but.
Yeah, I get what you mean, yeah. So mouth ulcers, a lot of things can cause mouth ulcer, but a lot of them are really not related to cancer, a lot of them, so there's really no much bearing between a lot of mouth ulcers and cancers, And when you say mouth, the mouth is quite an odd thing. Is it the lips, the tongue, is it the cheek, is it the gum? Some of those things have nothing to do with cancer. And when I mentioned sore throat, a lot of sore throats are not related to cancer. So a lot of them. So if you get, so this conversation or this, I hope I have not stirred up that if you have sore throats, think of cancer. If you have sore throats, the chances that you don't have cancer is more often than not you don't have cancer. It's nothing. You probably need some antibiotics. Depends on what's causing your sore throat anyways. But if you have something persistent, that's the story. And also we need to improve health-seeking behavior, as the case may be. So if you have a mouth ulcer and it's not healing, becomes persistent, probably you need to see a physician to check it out, and to look at it. But it depends. So many things: nutrition, infection, trauma. A lot of things can cause mouth ulcers. Yeah.
There's somebody on this line. I want him to answer a question for us because it's there. Dr. Adamu, please, can you help me with something? There's a question here that talks about the prevalence of the rate. Dr. Adamu, please first unmute yourself, please. Our president of the Cancer Society in Nigeria is the one I want to see what the data is telling us, because there's a question here about what is the prevalence rate of head and neck cancers in Africa and Nigeria. And I think he may be the best person. And what are the common ones in Africa? So he will come on, but I think he may be able to help us to look at that from the African perspective, especially Nigeria. Or do you have the data? Do you have an idea, or are you comfortable with the data?
So I was looking at some of the data from Nigeria. The commonest ones was the I saw anyways, but and it was more like quite a while ago. It's 2012. Because I've not even seen any recent data, to be honest. Was nasopharynx, oral cavity, oropharynx, and larynx. Those are the commonest cancers.
What is larynx, by the way?
Larynx is the voice box, sorry. So larynx is the voice box. When I said that case, larynx is a voice box. So the voice box, the one in the back of the nose, back of the nose, the one in the back of the throat, those are the commonest, and the one in the mouth also. Those are the commonest cancers. Generally, head and neck cancer are not like in the list of the most commonest cancer in Nigeria. And the commonest cancer in Nigeria generally will be like breast, prostate, cervix, liver cancer, and all that.
Yeah, but we also do not want to get our data getting out of hand.
Yeah.
In Nigeria, because the truth about it is that the more we create an awareness for people to know that it's better to get the treatment or get the tests done earlier, the better for all of us. And now the one question I still have to ask is, what would be the main, give me 3 things that would be the main things we would need to look out for that should say alarm bells? Because like we seem to have one of the things I always say, because I'm a layman and I live with the disease, so I understand the disease very, very well from a perspective of an individual, not as a medic. But I always say to people, if you have a persistent illness, so if you have a persistent sore throat, to me, I would be saying to anybody that tells me that excuse me, after you've had sore throat today, it went tomorrow, you had it again, it went tomorrow, that means that I'm saying to you, please don't answer anybody again. Go and sit in front of a doctor and tell them you're not shifting until they tell you the answer. Now, I will say that only because I had a headache when I was diagnosed with cancer. And by the time I kept shouting, I had a headache. And the truth is, I can't blame any doctor because there was nothing they could have done. Every other vital sign was correct. But I had a headache. And by the time we realized what it was, I had stage 4 cancer. So that's what I'm trying to get at. Is there anything that, any message that I need people to get, that forget it, just what these 3 things, if they happen, just don't stop until you have finished getting to the bottom of it. Because that is what helps us to create the awareness in a way that works for everybody.
Yeah, so as you said, like there are quite a number of symptoms. You just mentioned one about the persistent sore throat. So persistent symptoms generally around the head and neck should be consigning. Any persistent symptom should be consigning for anyone. You know, if you have bleeding from your nose, you should be consigned for the first time anyways, and you want to check that out. Most times it's not. It's probably you had the trauma to the nose, or you know, it could be just simple stuff. But you want to probably see a physician, you know, to check that. If you have a new swelling in the neck, that's like something like that, I don't see any way around it. If you have a new swelling in your neck, that's likely serious from it. That most likely is serious. So you need to go to the hospital. And so the reason for just to reiterate, once you get some of these symptoms, it's important to know that you need those imaging modalities and those things I mentioned in the presentation to get. So if you go to the hospital, you need a CT scan, you need also an MRI scan, as the case may be. So you might need some of these things to get to the bottom of it, especially once your symptoms are persistent and the doctor is a bit concerned about them. So, but there's so many symptoms that can be around. You feel like a lump in the throat, quite a number of things also can cause that. But if you have a feeling of a lump in the throat and persistent, you know, and persistent is quite a variable time, of course, but, you know, one day, today, you know, as the case may be, you have to seek a physician to get that sorted.
My people perish due to lack of knowledge. You know why? Because from what you just said now, it just occurred, a process just added up for me for the first time. Last year, I had nosebleed, and I never related it to cancer. It was just nosebleed. But apparently by January, I realized there had been hemorrhage. And it was as a result of radio. And the cancer cells are back, are now all over the place again. That's another story for another day. But yeah, it's just interesting. So I don't know, the non-medics in the house, the normal everyday people that are here, please be very mindful. Little things really do, little things really seem to be things we have to be very aware of if we're going to be able to make a difference, especially to those around us whom we really care about. Because from what you are saying now, throat and neck cancer, yes, it's not a big deal. Yeah, not that it's not a concern, it is. But if we catch it early, or we are actually aware of what the symptoms are, then we are in a better position to make a point of trying to get that out. I'm going to say something. Caleb, can we have facts about this thing shared? I know that somebody else on the Nigerian Cancer Space is also sharing a lot of information about facts on head and neck cancer. I think this has opened my eyes to something I didn't realize. So you see, I didn't know. I didn't realize how much little things can make a significant difference, because we talk about the big cancers, but the small cancers, if they're solvable, we start to look at the data to solve them and bring them off the list, which is important, I think. Thank you. Has anybody got any questions in the house that want to ask? I didn't get Dr. Adamu. I can't find him. The only person, oh, there he is now on. Dr. Adamu, we've been waiting for you.
Hello, good afternoon. Sorry, I had to step
Our
out
President.
to pray. Good afternoon, ma. I actually stepped out to pray, just came back in. Unfortunately, I missed a greater deal of the Q&A.
I give you the question. Do you know the question?
Okay. No, I mean, as in, I had wanted to be part of the Q&A. I thought before I...
No, I haven't finished though. I've got the Q&A for you. I've got a question for you. The question is, what is the prevalence rate of head and... No, Doc, you can't run away from the president. That's not going to work.
Okay.
What is the prevalence rate of head and neck cancer in Nigeria? That was number one. And number two, what are the common cancers of head and neck in Nigeria and Africa? Those two questions.
Okay. Well, actually, for the common cancers of head and neck, I think Dr. Charles has done justice to that in his presentation. But again, don't forget that in Nigeria or in Africa, or in fact across the globe, the major cancers that we have overshadowed most of these silent cancers, especially cancers of the head and neck, cancers like that of the breast, cervical, prostate, the lymphomas and all that. So basically, people tend to pay more attention to these very common cancers. And if you notice very well, even research work is basically concentrated around these major cancers. So now, we are back to the wahala here in Nigeria, and in fact in Africa, the lack of data, the lack of statistics. Head and neck cancers are not truly very common cancers, and like I said, not too much research has been conducted in that field. So the data in most instances is not actually there. The statistics will not show a true reflection of what is on ground, because most of these cancers are underreported and are not even there. So that's the reality. But I believe Dr. Charles, being an African himself, must have done justice to that. I actually saw one question in the chat box that is very interesting. I don't know whether Dr. Charles has addressed that regarding the HPV vaccine as a cause of oral cancers. And somebody was asking whether the HPV vaccination for young adults, for young children between the ages of 12 to 16, will also go a long way in preventing those cancers. A very interesting question, actually, and I think the major issue there, the concentration is on cervical cancer, because of course oropharyngeal cancers are not too common, are not very common as compared to cervical cancer. So true, if our young girls and boys, don't forget HPV vaccination is not only meant for young girls, and boys can be vaccinated against HPV vaccine. I think it will go a long way in preventing other forms of cancers that are caused by HPV, the human papilloma virus. Now, the problem there is the fact that we are looking at immunizing young children between the ages of 12 to 16 across board in a national program, say in Nigeria. That has not been possible over the years, talk less of general immunization for everybody before the age of 26. That's immunizing everybody against HPV vaccination. So the first is to achieve, because cervical cancer that has one of the major causes being HPV vaccine, the HPV virus, the human papilloma virus, is highly preventable when HPV vaccination is administered. But nothing is being done. Government is not serious in implementing a national rollout that will ensure that there is vaccination across board. So my mind is not actually a question. I have been following, yes, right from the beginning. Sincerely speaking, head and neck is one complex area, because even I remember my anatomy class. One major component of anatomy I had serious issues with is the head and neck. The head and neck, as people see it, may look small, but it's a very big area. It's an area that is very complex and big. By the time you start to identify the structures that are there between the neck and the head, one will be overwhelmed. So I truly want to applaud Dr. Charles for doing justice to this very topic, head and neck cancers. The way he delivered the presentation was in such a way that it will make sense to the person that has never gone to medical school. It's as simple as ABC, and it was very impressive. He didn't really dwell so much in the complexities of the terminologies. I overheard Madam asking, "What is larynx?" By the way.
Indeed, I was asking that one.
yes, but
Okay.
but sincerely speaking, the way he presented the topic was quite impressive. I have not gone to see his resume, but I believe he is somebody that is vast in this area.
Don't worry, you will find him now. President, don't worry, you will find him.
I want to truly appreciate him, and I hope you will bring him back one day so that we now so that he can take one or two of these cancers, like the laryngeal cancers we talked about, the oropharyngeal, CA, and maybe the mouth, and one or two areas to concentrate on, so that people will be informed, so that people will know. Because some of these things like tobacco, chewing tobacco, the way people take shisha, and so many other unhygienic practices that in the long term will give rise to chronic irritation that will result into these cancers needs to be addressed. And I believe Dr. Charles will do justice to that. His manner of delivery is fantastic. So I thank him very much. And to Commode Cancer Foundation, Ma, I truly want to appreciate you and your team, because the consistency is legendary. The consistency and the intensity, and the purposeful approach at maintaining the tempo is quite superb. And I have to appreciate your commitment is second to none, Ma, and we truly appreciate you.
Thank you.
The program, the Let's Talk About It series, the program, sustained monthly program on the AIT has gone a long way to show that with the proper commitment, we will get there one day. So I thank you very much on behalf of all cancer advocates in Nigeria for doing justice to this topic and for being resolute in the awareness creation. So thank you very much. Thank you.
Thank you. Dr. Tessie has something to say. So before I close, I think I'm going to let Dr. Tessie say. Dr. Tessie, thank you for agreeing to say something. And then what I'll do is I'll round up so that we can finish sharply. Dr. Tessie, are you unmuted? Yes, you are. All righty.
Okay, good afternoon, everyone. Thank you so much for having me. And thank you to Dr. Charles for doing justice to it, even though I joined late. It was a very nice session. I just wanted to add something to what Dr. Adamu has just said. Yes, we don't have, of course, we know that it's a big problem in Nigeria. It's one of the prevailing problems for cancer. Our statistics are really, not handy. And so you can't say about prevalence or in most cases, you can't come up to, give 100% data on, certain things. But I just want to say that head and neck cancer, I don't know if Dr. Charles covered that, but I know that apart from all the other cancers that we commonly talk about, like, breast, prostate, colorectal, cervical, is one of the common cancers we see. So even though, we don't have the right statistics to say, and remember that it involves almost every type of tumor around the head and neck region, except for maybe the brain tumor and the orbital tumors. Quite common. Quite common. You see, like when you cervical, colorectal, that you have a lot of head and neck cancers, especially nasopharyngeal, tongue cancer. So it's a common thing, and I want to commend, even though we don't have statistics to back it up, but these are common cancers we see in the clinic. These are common cancers we see. So I want to commend you for topic, though it's a wide one, but most of the risk factors for head and neck cancers are the same, and can cover for any form of head and neck. Same. It's common one.
Thank you. I'm about to come back to this because that was when we started. The first night I was about what is the data for? And I'm very glad you helped us to answer that question. I'm not sure. I don't know if the network is going because I can see it fluctuating, but the truth is that because knowing that they are curable, or at least quite a lot of them are curable, is best for us to be able to make noise about it. So we are going to. I want to say a very big thank you to you for your contributions. Dr. Charles, you can see we need you on this platform. And you know that they're very excited to tell you how you have to come and add some more stuff to this conversation. Let's talk about it. Cancer is run monthly. It's on Zoom. We also have our AIT program, which runs every 2 weeks. Next week, we are going to be talking about endometriosis. Let me just use the layman English of the cancer that is related to that. That's the way I can say it, because I'm not a medic. I can't pronounce half the words people use. And that's going to be on AIT Live on Wednesday. Next month, we are having a conference, a webinar, and we are bringing in speakers from all our partners. So we have representatives from Nigeria, UK, Africa, to come and talk. It's going to start at 1, and it's a 1.5 hour. It is a webinar, and we will be advertising all the information on it timely, so that we can all be able to, so that we can all engage in it and have the questions down for the different speakers. That will come out in the next 1 week. We're just trying to tidy up our speakers. What else do I have to say? I want to say very, very big thank you to everybody. Dr. Charles, thank you very much for joining us. Thank you for being part of this. Thank you for agreeing to educate us on these cancers. And to all those who contributed, I want to say a very big thank you to you all for being on. And we'll pick up everything you can. Everything we've done here will be on our YouTube channel. You can watch, you can follow us and subscribe on our YouTube channel. We're on Facebook, we're on Instagram. Everything is all there for you to go and get the information you require on what we do. And finally, on behalf of Common Cancer Foundation, I'd like to thank everybody. Quite a lot of you have answered our call for our fundraiser. I want to say a very big thank you to all of you, and for your support and encouragement in making this continue. It's a sustained program, but we will get there. So I will be seeing everybody on AIT Live on Wednesday at 8:15, and we have Dr. Alex Onyonyo, who's going to be the one speaking at that event for 30 minutes. You can follow us on, I've told you where you can find us. Common Cancer Foundation, email us, Facebook, subscribe, anything. You find us. We're there. Our phone numbers, everything are all there. We'll see you soon and have a great weekend. Thank you.
Thank you very much.
Thank you, everybody.
Have a great weekend too. Bye-bye.
Bye.